there. So thank you for that. Thank you for participating, and good luck to you. And if you see me there, help me out. All right, we've got to start on quite immediately. Got a packed show. We're going to be talking about breast cancer, and in particular breast cancer for those women 70 plus. There's a major campaign, I know you've probably seen this on your TV screens, a major campaign at the moment talking about breast cancer and the fact that we need to, all of us, with our aunts, our mothers, even ourselves, check ourselves out and go to our GPs most regularly. But we're talking about, in particular, African and African Caribbean women, 70 plus, making regular checks and going to their GPs. Breast cancer it doesn't see any colour. It really doesn't. There's no prejudice here, but we want to concentrate and focus a bit more on African Caribbean women. In the studio with me today, and I'm going to do this, and I have to put on my best voice to do this. We've got consultant surgeon from the King George's Hospital in Ilford, Koge Ogedegbe. It's a pleasure to have you here, and thank you ever so much, because I know you're extremely busy, sir, and for you to come out and take this time out, thank you ever so much for being with us.
Thanks
we
for having
also
me.
have cancer breast survivor Felicia with us in the studio, and it's gorgeous seeing you. Can I just even say, you can't tell. To me, I can't tell. I wouldn't have known. I walked past you on the street. I never would have thought. You look so nice. Thank you ever so much for coming out and talking about, your experiences. So let's kick off, shall we?
Of course.
Let's go straight to the, if I can call it, the technical part of it. Be Clear on Cancer Breast campaign. This is what I've been talking to our viewers about. I've been seeing it on the TV for months now. Be clear on breast cancer. Talk to us, is quite explanatory, but talk to us. Why is it so important to be clear?
Well, I think your introduction is quite good, and we've just seen Felicia here, who looks a picture of health. You will never have known she's had breast cancer. And what we intend to do with this campaign is to make sure that we pick up breast cancer at a very early stage. To have patients, or she's no longer a patient, to have people like Felicia looking healthy. So the whole idea of all this is to be clear that, one, breast cancer affects a lot of people. The incidence of breast cancer in the United Kingdom is 1 in 8 women. It's more common among Caucasians or white women and less common amongst black women. But when you reverse that and you look at the death rate, the death rate from breast cancer is actually worse in black women compared to white women. Now, today we are discussing breast cancer over the age of 70, and 1 in 3 breast cancers that are diagnosed in the UK is in women over the age of 70. If it's picked up early, treated early, the lifespan of those women is not compromised. And the key message today is to ensure that all women, especially those over the age of 70, have the regular checks and assessments that help them make an early diagnosis, early treatment, and therefore do not have their lives compromised by breast cancer.
Yeah, indeed. From a certain age, we're all being taught, when we're in the shower, in the bath, what have you, in our private rooms, sort of check ourselves. Yeah, it's important to check ourselves. But there are, and surprisingly for me to know this, there are non-lump symptoms.
Yes.
Now, so if we're being told to check for lumps, but there are, what are these non-lump systems?
That's a very important point you just raised. The common theme is that breast cancer usually presents with a lump. That is true in a proportion of cases. But with an increase in technology, increase in screening, most nearly 50% of breast cancers we see now is picked up on pictures called mammograms. Now, besides having a mammogram, there are other symptoms of breast cancer which we all need to be aware of. And that's changes in the skin, changes in your armpit, having a rash on your nipple, having nipple discharge, having your nipple change color, having some discomfort in the breast which you cannot put your finger on, which doesn't go away, and just having your breast change. In my practice, I encourage my patients to come and see me for the simple reason that coming to my clinic say, oh, Mr. Ogedegbe, I just don't know what the problem is, but my breasts don't feel the same. Now, for most for most women, that is actually quite a significant symptom to go and see your doctor with. If you attend a breast clinic, we have something called a triple assessment clinic, where you have a clinical examination by a surgeon like myself. You have X-rays called mammograms or ultrasound scans, and if necessary, a biopsy to try and establish a diagnosis. But it's important to stress that a great proportion of patients who come to our attention actually do not have breast cancer, and they are reassured. That is very important because when you have an abnormality in your breast, what you want is reassurance that it's nothing serious.
Yes, yes. I didn't want to get personal, but I have to. A couple of years ago, there was what was seen. It was a mobile sort of clinic, if you will, and I was asked to go along, and what was seen as a little clump, so I was asked to go to the Edgeware, a specialist breast clinic. I must admit, within that time, they're very sharp. Within 2 weeks, they call you in, and I must admit they were very sharp. But I must admit, in those 4 or 5 days,
anxiety.
It was very, very scary. Right. But the good thing about it, as you said, I went for the mammogram, the big machine. Yeah. And I was even shown the X-rays, and it is reassuring. It is so reassuring. And what I did like was the response. So quick.
You've raised an important point, and what you've just described is the National Health Screening Mammogram. And can I say, you don't look a day over 40, so I'm a bit surprised you're invited. Anyway, when you're invited for these mammograms, and it usually ranges from the age of 50 to 70, and you're invited every 3 years. When you're invited, you have 2 views of mammogram. In other words, the breast is looked at through 2 different angles, just to try and capture the whole breast and make sure there are no abnormalities. Now, most women who attend that assessment are reassured and they're discharged. Unfortunately, a small proportion of those women are invited back either to have a biopsy, or unfortunately they are told that there's an abnormality there which needs some treatment, which is a good thing because we know that if your breast cancer is picked up at such an early stage, you have a 93 to 95% chance of being alive in 5 years. And the alternative is your breast cancer presenting at a very late stage where you've had a lump which is probably spread somewhere, maybe to your armpits, to the glands in your armpit or elsewhere, and your life is significantly compromised because the survival rate there is no more than 15 in 100. So that is quite significant. But the good news is for everyone is that that breast screening program I've just described has now been extended. And so we now invite women who are at the age of 45, and that's been extended to the age of over 70. Furthermore, even if you had a symptom, you haven't been invited, you can invite yourself. You can just ring up and say, I'd like to have a mammogram. I'm over 70 or I'm under 45 and I haven't had one. Please, can I have one? And the system will be very, very delighted to have you and offer your mammogram.
Yeah. Let's move on to Felicia. I hate to keep you out in the cold here, Felicia. So I'll have to come to you. Can you just tell us, what were your first signs?
My first signs was I had a little pimple on my nipple, which I ignored to begin with, thinking it was dermatitis. Because I'd had dermatitis, the same thing on my skin previously.
Yes.
So I ignored it.
Yeah.
But then that became a sore, it started oozing. Then the nipple started changing colour.
Yes.
And then it changed shape. And I had a mammogram coming up, otherwise I would have gone to my doctor straight away, but I had a mammogram coming up within the next couple of weeks, so I decided to mention it when I went to the mammogram.
Yes.
And so they looked into it a bit further. They said, well, because you've walked that up, we'll look further into, we won't do the normal mammogram check, we'll
go a bit in depth.
And which they did. And they saw a shadow on my wall, chest wall, and said, oh, it's probably nothing, don't worry too much about it. But within 2 weeks, I was at St George's Hospital, having a full mammogram and a what do you call it, the MRI scan, and they discovered that I had a very, very small lump on my chest wall.
Very small.
It's a matter of
But still,
first stage is
serious enough to
Yes. And within a month, I was in the hospital having it removed.
Within a month. You see, I love the quick response. You see, this is what it is. And wasn't that a bit reassuring for you, Felicity, that they dealt with it like this?
It was.
Yeah.
I was so surprised that it was so quick, because
Yeah.
I was thinking, oh, I'd have to go private or something. Nope, straight away.
Brilliant.
Yeah.
And you know, we were talking about King George's Hospital. We've got a consultant here that's looking the business, and he's talking the business, and he is the business, and many of his colleagues are as well. Let's think about other people who are in other parts of town. You know, what are they get into the right sources? They get into the right places to get immediate results. Is it the same?
With breast cancer, it is very good. Felicia, fortunately, has had the opportunity to be in one of the better parts in terms of treatment and diagnosis. And prior to this interview, I had the opportunity to speak to her, and she's been treated at St. George's and Royal Marsden. You really could not get better than Marsden when it comes to breast cancer. But I have to say, though, that all of the hospitals in the United Kingdom, all of the breast cancer units and breast cancer centers work towards the same timeline and deadline. So from the time you see your doctor, that's your GP, with an abnormality in your breast, you will be seen within 2 weeks by a specialist like myself. And if you see me within 2 weeks, within 4 weeks of me telling you you have a diagnosis, you will be having an operation. And that is how good the system is. And we have all sorts of targets that are monitored on a regular basis. And it's really, really brilliant. And so the service is excellent. And one has to say, if you have a breast pathology as a woman, please go and see your doctor, have it checked out, have the biopsy. If you need treatment, it will be good. The outcomes are wonderful.
Yes. Can I say also, I've been taught this. If I'm incorrect, please let me know with your experiences and your know-how. It's usually a historical thing within the genealogy of your family. When I went, was your mother or anyone in your family? That's the first thing they asked me. Now, did you have that, Felicia? Is there a history of...
My grandmother had cancer when she was over 70, so I did expect to get it, but...
You didn't expect?
Well,
it's a lottery, isn't it?
Not...
If you have X amount of daughters or granddaughters, isn't it that maybe one skips?
Well, my mother skipped it, but you know, it didn't. When they told me I had it, I wasn't surprised, because I thought it was a hereditary thing.
Yes, yeah.
And she got it in her 70s, and I was really surprised that I was in my 50s when I got it, and it was like, oh, it's too soon to have it, you know.
Yeah. But so, you know, one who may not have that in their family and told that you have got it, is that something that comes out of the blue?
Unfortunately not. What we've been talking about essentially is the risk family history of breast cancer and your risk of getting breast cancer in your lifetime. Now, we know that people who have breast cancer in your family, so you have your mother, your grandmother, your aunties, or your sister with breast cancer, your risk is high. Now, for your risk to be high, there are a variety of criteria. So you need more than 3 members of your family with breast cancer under the age of 60 to be in the high group. You need a member of your family who've had breast cancer below the age of 40, or a member of your family who has had both the breast removed or their ovaries removed as a result of cancer to have a high risk. We shouldn't get too bogged down on risk factors of breast cancer, because we know that 1 in 8 women have breast cancer. That's already a very high incidence.
Anyway, right.
So the high risk is on the other side, but 1 in 8 women is high enough. And so you can imagine, if you say 1 in 8 women have breast cancer, and over the age of 70 is 1 in 3 women. So most people, if they live long enough, will have one form of cancer or another. So the important message still has to be, if you notice any abnormality, any symptoms at all, please go and see your doctor. If he's concerned, he will refer you to see a specialist like myself, and he'll have the necessary investigations to at least reassure you, if not make a diagnosis.
At least. What is the procedure for your recovery period? You are a survivor, Felicia, but what are you going through still to maintain your good health, if you will?
Well, I'm in remission. I have to take medication for 5 years, and every year I have to go and have a mammogram, and just live life, basically.
That's it, yeah. Live life. Yeah. This is it. Yeah. This is it. Live life. The support mechanism, family-wise, is that important? Tell me.
It is, and also there are a lot of support groups out there as well. That, you know, I'm lucky where I am. There's a local group down the road that I can go and speak to somebody. I can have massage. I can have Reiki. I can join Tai Chi. And, you know, they have groups, and these are all over the place. And generally at the hospital they'll tell you about it. And there's also a group afterwards. After you've had the treatment, you go back and you speak to somebody, and they don't just talk about your treatment, they talk about how you're feeling, what support you're getting, are you depressed, because some people do become depressed after it, and and then they'll put you in contact with various groups that can help you. So yeah, there is a great support mechanism out there.
Like you're saying, Felicia, is it important to talk to women likewise? Is that important?
Yeah. It is, and funny enough, the one thing they said to me when I was at St George's, because when I first heard I had cancer, my first thing was, oh, I'm not going to tell anybody, I'll keep this to myself and go through this myself. Okay. But the first thing they said to me is, tell people about it. And when you do start telling people about it, you realise just how many people out there have been through the same thing, and they're there to support you and speak to you, and they help you through it. Yeah. You do need to tell people, don't hold it in, tell people about it, and they will help you.
Yeah. This is important to know this, because people do like to keep things in, and in particular when they're waiting for the results as well. That's the worst time, but it's the time where you do lock it down. And that's what I was guilty of doing. I locked it all down. Let's talk a bit more about a woman who has gone through the GP stage and now she's being sent to a specialist. Because a lot of women out there, I think they see it a bit like taboo. Oh, I don't want to know. If I've got it, I really don't want to know. How important, just stress that again to us.
When you come into a clinic like mine, you have a clinical examination, or if you've already had one, or you're having a diagnosis. It's important that you engage with the process. Otherwise, it becomes very difficult to treat you, because for us to treat you properly, we need your consent. And if you're not engaging with the process, you're not consenting, then it's difficult to move forward.
Yes.
Furthermore, research has shown that those patients, not just in breast cancer, in all cancers, who have a positive attitude to the diagnosis tend to do better.
Yes.
Now, there is no science to try and explain it, but that is what research has shown. And so when you come into the clinic, you're given a diagnosis. Usually in that clinic environment, you have support people. There are people called cancer nurse specialists who sit with the consultant to give you the diagnosis. Yeah. And usually when you speak to a consultant who's telling you so many things that you really don't want to know about, you switch off. That is natural. But usually at the end of that consultation, the clinical nurse specialist goes out with you, spends perhaps another half an hour with you, trying to go through things calmly in a very comfortable room, possibly with your relatives around you, just explaining the process to you. We have to emphasize, though, that treating a patient with breast cancer is a process. It doesn't all happen in one day.
No, it can't.
And you cannot get all the you cannot take in all the information in one day. It comes to you in chunks. So if you were going to have a combination of treatment of surgery, radiotherapy, chemotherapy, and drugs, that whole process takes a year. And so we introduce you first of all to the surgical aspects, which happens first. If you needed chemotherapy, that comes up afterwards, and then radiotherapy after that. So all these things come in bite-sized chunks that hopefully patients can manage. And for those patients who are unable to cope with that information, there's so much support network out there within the hospital environment and outside that just helps them get through the treatment.
Let's also go back and be specific about this. African and African-Caribbean women that reach to a certain age may feel a lump, may not. But what is it stopping them? What is it that could be stopping them from going to their GP and literally getting themselves seen? What could it be? I'm asking for, the reason I'm looking at you, Felicia, because you actually went. Now, what made you go and others don't? I'm thinking you've spoken to people who and I'm sure some of them have said, actually, I didn't want to know. I'm sure some of them said that, but why didn't they want to know?
I can't really answer that, but I do know, like from my parents, they were if they had illnesses, they never used to tell us about it. So we didn't know until the more recent years. We didn't know if others in our family years ago died of certain diseases or conditions or anything, but they never used to really speak about their illnesses or their problems.
It's true.
It's starting to happen now.
Yes.
So hopefully now more people will take notice and go.
Yeah.
And the fact that nearly every time you turn on the TV these days, there's something about breast cancer.
Indeed.
And it's, something's going to stick, and it's like, let's go.
Yeah.
Hopefully.
But I'm also thinking about daughters and nieces as well, because they are stubborn. The older generation are stubborn, because I didn't know about whether my mum had this or that until she was in hospital. Yeah, because this is what happens. So it's about also the nieces, the daughters, the sons, keeping a watch, keeping an eye out, and perhaps saying, "You all right, mum?" And maybe getting more involved.
And see, another thing is, as you're growing up, you go to a doctor and they say, "Has any member of your family had this condition?" And it used to be, "Well, I don't know." So it's trying to get them to open up, because they could be putting their children's lives in danger.
You need to know the history. You need to know. Everyone needs to open up now, very much so.
If I might come in here, Pam, sorry,
Please
forgive
do.
me. Now, I have a passion for this.
Yes.
I'm Nigerian by birth and upbringing, and things are slightly different. Slightly different at home. When I have a black woman, especially who comes into my clinic with breast cancer, the first thing I tell them is, look, you must have the treatment, okay? Otherwise, you are going to die. And you have black women and maybe some Asian women with all forms, for a variety of reasons, they don't engage with healthcare. You have a problem, African women especially, they start off by going to the pastors, they visit a spiritualist, all sorts of things happen. And it comes to the time of diagnosis, and there's a phrase amongst, especially Nigerian women, I have to say this because they all watch Ben TV.
Yes.
It's not my portion. I reject it. Now, when you start like that, it's unsurprising that the outcome is bad.
Yes.
So the key message for especially black women and Afro-Caribbean women is, if you have a diagnosis, please engage with the specialist. They are there to treat you. People have all forms of phobias. There are religious barriers, there are language barriers, there are educational barriers, there are trust barriers. People from our community still don't trust the healthcare service to look after them properly.
Yeah.
Now, fortunately, there are more and more black nurses, doctors, social workers
So
in
they
the
can
system.
relate to-
And the hope is that they would have treatment. Only last week I had a lady who walked into my clinic, 83-year-old lady who is of Caribbean descent, and she's an ex-nurse, she's an ex-midwife, and she has breast cancer. And I said, look, we think you should have treatment. She said, no, I'm past it. What do you mean you're past it? She's only 80.
Oh,
she
God.
has her faculties with her. She can communicate effectively. And we know that if you are treated for breast cancer, at an early stage, you have a 93% chance of being alive after 5 years.
There you are.
If you're treated at a late stage, you have only a 13% chance of being alive at 5 years. So the difference is clear. There's an 80% survival benefit if you're treated early. And if we can convince the older generation to have treatment early, then it's easier to deal with the 40-year-old, 50-year-old and get them into hospital, have the appropriate treatment, and move forward. It's important, especially for black people, you see. It's a lack of engagement that holds us back as a community.
Indeed.
You don't engage with healthcare. You don't engage with education. You don't engage with social services. You don't engage with employment. And so the whole society and community is held back. It's important we engage and make a difference. And if we do that, then we can lift the whole society up and begin to make an impact.
That's a positive note to end with. That's a positive note to end with. What I need from you now is to give us information where viewers can find out more information.
If you need to find out more information, you can go to our website. It's www.nhs.uk/breastcancer17. And there are various cancer charities for breast as well, Breakthrough Breast Cancer and a variety of others who will be there to help you. But please, 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 if you are invited for breast cancer assessment, have your assessment. If you're a black woman, it's important you come because we can treat you and improve your survival.
Definitely. Thank you ever so much. And that's lovely to end it with. Thank you ever so much. Let me do this correctly now. Consultant surgeon at King George's Hospital in Ilford, Mr. Koge Ogedegbe.
That is correct. Thank you so much.
Gosh, Felicia, love you, survivor. Keep it going. You look great. Thank you ever so much. Thank you ever so much. Thank you. All right, we're going to take time out now. Okay, we're going to sort of finish up our water and what have you, and we'll see you in a couple of minutes. Thank you ever so much.
If you have a property tenanted or empty, contact KeyRight on 0208 808 5789, where you'll be sure of expertise.